What's up, guys? This is Dr. Kyle from Cape Chiropractic and Acupuncture coming at you with this week's movement tip of the week. Today we're going to focus on the thoracic spine, which is this area here, okay? And the common mistakes that I see with foam rolling. Now, the thoracic spine is a very important part of our spine because it is so intimately connected with how our neck functions, how our shoulders function, and sometimes even how our low back functions. But we commonly prescribe foam rolling to the thoracic spine to help with postural deficits or sometimes functional deficits that we see from a variety of things. But for most of us, that involves postural dysfunction from being in a chair all day. We kind of end up in this hyperkyphotic or very, very kyphotic position where our spine is bent this way. Now, what I see when people go and try to foam roll to make this feel better, which is excellent that they're trying to do something about their discomfort. However, I want to give a few suggestions or tweaks that can be done to help make this a more effective exercise. Okay, so what I typically see is when people lay on the foam roller, is what they tend to do is just lay on the roller and gently roll back and forth this way, right? And that may feel very good on the musculature surrounding the spine, and it may reduce some of the symptoms or tightness that you're feeling in your thoracic spine. However, it's not truly addressing what we as manual therapists or what we need to correct functionally, which is restoring thoracic extension. So if we're bent like this, and it's causing, and we've somehow found or identified that it's causing part of your pain, we need to teach the spine how to extend or get a little more flat in this area here. Okay, so what people tend to do, like I said, is just roll here, when in reality what we need to do is teach people how to actually extend or flatten out through that area. Okay, so what this looks like on a person is usually people are staying rounded like this and rolling back and forth like this, okay? Which, like I said, may feel good, but what I want you to focus on is finding that spot, okay? And actively extending over that area, okay? And then coming back. And really trying to reverse or flatten out that thoracic spine over the segments, okay? Like so. Now notice I'm not hyperextending my neck. My neck is in a stable position here, gently supported by my hands. Good. And you're going to go up and down the entire thoracic spine this way. Good. And after you do it a few times, a little cherry on top can be taking a big breath in the bottom position and letting it all the way out. And that will help to expand or extend through your thoracic spine even more. Now that was the major tip for this week. Stay tuned next week. We're going to talk about how to reduce low back pain first thing in the morning. Thanks, guys.